How are we doing today?
Doing good.
Good.
Excellent, excellent. Glad you're all here. And so we'll go ahead and get started. Jump into the public briefing for today. Today's April 27th, 2021. Dr. Cope, if you want to start us off, please.
All right, good morning. Let me get my screen started. Is my screen up for everyone?
Yep, good to go.
Okay, great. Thank you. Did I miss you? Did you mention that this is being recorded, Chief Bruner?
Oh, sorry, Libby. Let everybody know for participation and monitoring. Today's briefing is being recorded and will be published at a later date, hopefully today or tomorrow. Thank you.
Great. Thank you, Chief Bruner. All right. Good morning, everyone. My name is Dr. Libby Cope. I'm the health officer for the Makah tribe, and here's our COVID update. At this time, I'm happy to report that 2 of our most recent cases of COVID are recovered, which means we have 1 active case in Nia Bay. And for those of you who are tracking dates and looking at that and saying, hey, that's not exactly 2 weeks. The way that quarantine goes in isolation when you're diagnosed often is that it starts from the date of first onset of symptoms. So all of these patients have been followed very closely and monitored, and they've been released from quarantine and declared recovered according to the guidelines that we have been following this whole time. So at this time, again, we only have 1 active case in Nia Bay. They are doing well and are medically stable. And then on this next slide, we do have 5 individuals who are in quarantine stemming from 2 households. One of those is related to the positive case, and the other is a known exposure to COVID that happened last week off the reservation. Collin County continues to be high risk. Their percent positive has decreased a little bit from 6.2% to 4.6% as of yesterday. They have 42 active cases. It is estimated that about 50% of their new cases may be caused by the variants. That's not confirmed and likely won't be. The state does not do genomic sequencing of the test samples for every single test that comes back. So we will never know for sure if that is the case, but that is what is suspected. And then we have 3 current hospitalizations. A note back on the variants, we do have 1 confirmed case of the variant B117 in Clallam County. We don't have any confirmed cases of the variants here in Nia Bay, and that's because it takes 2 to 3 weeks, but we will know within 2 to 3 weeks if we do have that in one of our new cases. This is the just a screenshot from the website on Clallam County's page. And this is just a visualization of that data. As you can see, it's decreasing down here on the right, but it's still much higher than even some of our earlier spikes last summer. So certainly watching that closely. Washington State cases continue to rise, and they're rising at rates that are higher than our highest peak last summer, but are lower than our Thanksgiving and holiday spike that we had at the end of the year this year. The rate of rise has slowed down a little bit. Washington State is still following the roadmap to recovery plan. The next evaluation of the metrics for that plan is May 3rd. And right now, all these counties that are in green are in phase 3. And based on the metrics, counties will either stay in phase 3 or go back to phase 2. And this is a link down here to more information about what that means for those counties. Here's our update on the variants in Washington State. Most notably is this variant right here, P1 from Brazil. It's more than doubled significantly, and this is all along the I-5 corridor. So this is the one that has state health officials and the health officers in those areas most concerned, because it is certainly rapidly increasing. We know that the vaccines are less effective and that there's a more severe course of illness with this particular strain of the virus. So that's the one that Washington State's certainly keeping its closest eye on. We don't have any known cases of that in any of the surrounding counties of Clallam County. Again, we don't always know because they only test a limited sample for the variants of the known positive cases. So. And these are the variants of interest, haven't risen to the level of variants of concern yet, but we do have cases of them in Washington State. Here's what things look like for the US right now. In general, as a whole in the country, they are tending down. So the rates of new cases are trending down. But what we see when there's after any sort of spike is that a couple weeks later, there's a lag and then things start to increase with hospitalizations and with deaths. So right now it's only starting to slightly rise with hospitalizations. It hasn't impacted deaths yet, but that's what would be predicted just based on previous trends. Just a quick note on what is in the news around India right now. So in the last 2 weeks, they've seen a really rapid increase in new cases and unfortunately deaths. So that's something I just know is in the news and wanted to put up a graph for everyone to see. I just did a little bit of research yesterday on what we think is going on there, and it's just quoted to be a perfect storm. There's a few crowds that have happened. These comments are directly from this quote from the Public Health Foundation, but so they just described crowd behaviors, reduction in government, just policies, et cetera, around COVID, and then having an increase in the variances that are more transmissible. So we are continuing our COVID vaccine efforts here at Sophie Chardovic Indian Health Center. We will have our next Pfizer vaccine clinic is next week on Wednesday. That's when our first doses will be due for their second doses. And then we will also offer first doses as well. It's going to be from 1 to 5 at the community gym. We highly encourage, everyone who hasn't been vaccinated to come. We will also have our Moderna vaccine clinic. That's happening on Fridays. And it will be at the clinic. So now we're doing that just in our parking lot out here at Sophie Chardovic. And certainly encourage anyone who hasn't been vaccinated yet, or if you haven't received your second dose yet, and you've gone a little bit past the time, please give us a call and we will get you scheduled in at the time that's best for you. Other news this week, Johnson & Johnson was reauthorized for use. This is not a vaccine that we have used yet and haven't started or restarted, I should say, plans to use it. We were just kind of on the verge of getting ready to expand to include Johnson & Johnson, and then it got put on pause. So we will start to revisit this as an option. What I do want everyone to just be aware of is that it's possible, not for sure yet, but possible that there will be a need for a booster COVID vaccine sometime between 6 and 12 months after the first round of doses. So we are preparing for that. At this time, no vaccines have been authorized for use younger than 16, but they have requested. So Pfizer has requested that the FDA expand their authorization for use to 12 to 15-year-olds. No response on that yet, but once they do, we are trying to be ready for it. And then just to be prepared for the COVID vaccinations being an ongoing effort, especially as we look at these boosters and rollouts of authorizations for younger ages. We're going to continue these clinics and really doing everything we can to make sure the community is protected. So our most recent group of data on our rate of vaccination. So we added the community's base population of 16 to 17-year-olds. So that expanded the number of people who are eligible for the vaccine. So even with increased people getting vaccinated, we're still at 73% who've gotten 1 dose and 66% who are fully vaccinated. I certainly want to see that increase as we go up. And one thing I just like to make sure people are aware of is that this is just 73% of the people who are eligible for the vaccine. So that doesn't mean 73% of our whole community, because everyone 15 and under is not eligible, the vaccine has not been authorized for use on people 15 and under. And that's a large part of our community that remains unprotected. And as we've seen over the last 2 weeks, 2 of the 3 cases were those who are 15 and under. I just want to acknowledge this morning CDC released new guidelines for fully vaccinated people. We haven't reviewed this closely, but I took a couple of screenshots of the infographic that they used to show what is safe for fully vaccinated people and what is safe for unvaccinated people. And then they used less safe and least safe for the red. So on this component of the slides, it's just outdoor activities, and you can see where they put masks on. So certainly take a close look at this. I've put the link to it at the last slide there, and I can put it in the chat when I'm done. So this is just continuing. It's one infographic that I cut into a couple of pieces to fit on the slides. So this is indoor, and again, less safe is the yellow on this side for on the left, unvaccinated people, and then on the right, fully vaccinated people. So showing again that fully vaccinated individuals do need to continue wearing masks in a number of situations. And then this is just the last part of that infographic that I mentioned. And again, please just notice all the masks. And I will cut and paste and put that link in the chat when we're done. Otherwise, I'll pause for questions.
All right. Well, thank you, Dr. Cope, for the update, especially the new CDC guidelines. I just want to remind everybody, we'll review those guidelines at the EOC meeting this Thursday. And if there's any changes or anything forthcoming, it'll be presented to council for approval, and we'll move forward on that. So thank you, Dr. Cope. As far as the Makah tribe, no updates for today. I want to put a reminder out from the Makah EOC that masks are still mandated in public places. As of this point in time, I know there's CDC changes and the state's making changes, local governments are making changes, but at this time, the Makah tribe still has instituted the mask mandate in all public spaces. So that's a reminder for everybody. Want to remind everybody, if you're traveling outside the area, please practice travel safety protocols. If you need guidance on that, please visit the stick.org website, which is our most recent and updated source of information that's approved through Makah Tribal Council for the Makah Reservation. Want to remind everybody that Rickson and Erica are up at the Village Market as we're speaking, handing out masks and filling up hand sanitizers, and also handing those small bottles out for the community. So if you're in need of it, please stop by and see them. Thank you guys for participating in the meeting, and also being out in the public, distributing all the materials and safety stuff for everybody. I want to remind everybody, practice social distancing, wash your hands, surfaces frequently, also wear your masks, stay home if you're sick. As of right now, Mr. Eastman in the chat has put the Presbyterian will not open the outdoor basketball court at this time. So we'll put that notice out, and once it's republished, it'll be available for anybody not in the meeting today. So that is about all we have for the briefing today. I want to thank everybody for participating. See if there's any questions or anything real quick before we sign off. All right, not seeing anything. Thank you guys. I want to thank stick staff and EOC, Makah EOC. Thank you guys for all the hard work. I want to thank also the community and Makah Tribal Council. You guys are doing great. We still got a little ways to go, so keep your heads up, keep fighting, and keep moving forward. Thank you guys, and have a great week.